Okay. Hi, everyone. Welcome to our video chat, our very first Conversaciones con la Comunidad. I'm Sarah Benatar, the Coconino County treasurer and also one of the chairs of the LatinX committee of the Coconino County Dems. We have some special guests with us today. So I'm going to go ahead and start off with introductions. And we have Dr. Susie Lopez. Dr. Lopez is a medical doctor working with COVID patients in Rush Medical Center in Chicago. We also have Professor Stephen Nuno, who is a professor at the Northern Arizona University, NAU. And we also have Angelica Sanchez, who's going to be helping me today as moderator of this great session. Buenas. Voy a hablar un poquito en español, así los que están viendo pueden entender inglés y español. Tenemos con nosotros la doctora Susie Lopez. Ella es una doctora en la ciudad de Chicago y está trabajando con pacientes que tienen COVID. También tenemos profesor Stephen Nuno, que es un profesor aquí en la Universidad de Northern Arizona. Y ayudándome hoy va a ser Angélica Sánchez. Bienvenidos. Hoy vamos a hablar un poco sobre COVID-19 and la vacuna. Today we're going to have a conversation about COVID-19 and the vaccine and hopefully be able to answer your questions in regards to all about the vaccine, everything from when it's available, side effects, and also talk a little about COVID and the spread and hearing it directly from an expert, so to speak, with Dr. Lopez. And also Professor Nuno is going to provide us with some data in terms of what our communities are concerned about and hearing in regards to COVID. So Dr. Lopez, do you want to just start off with any words before we get going?
Sure. Thank you for having me. I'm really excited to talk about this and help answer any questions, hopefully give everyone some answers so you can have the information that you need so you can make the best decisions for you and your family. Gracias por tenerme aquí. Estoy muy emocionado por estar aquí y responder a sus preguntas para que tengan la información que ocupan para hacer las decisiones que van a ser mejores para ustedes.
Gracias, Doctora Lopez. Stephen, or Professor Nuno, do you have any welcome words you'd want to share with the group? Oh, you're muted.
Thanks. I'm just very excited and thankful for the opportunity to speak to the folks who might come on here and listen to us speak about this important issue.
Thank you, Professor. And Angelica, do you have any welcome words before we get started?
Solamente estoy muy feliz de estar aquí y ojalá con el favor de Dios ayudarles a traducir y aprender más sobre la vacuna, dónde conseguirla y tal vez algunos datos sobre los efectos secundarios.
Gracias. Pues, Doctora Lopez, I'm mixing everyone's name right now. So you have a beautiful slideshow that's actually both English and Spanish, I believe. Even if it's just in English, that's okay. But do you want to first walk us through it a bit and talk about your experience with COVID-19 and also with the vaccine itself? Doctora Lopez, puedes empezar. Tienes aquí un PowerPoint y escuchamos primero de usted sobre la vacuna, sobre el COVID y tus experiencias con los dos.
Sure. I'll try and go quickly. This is a little bit longer of a PowerPoint, but just kind of a big summary, and then I'll talk a little bit about the vaccine. But I think just before I get into that, I'll say I've been treating patients with COVID since March. We still have COVID patients here in Chicago. Luckily, our numbers are a little bit better. But even when our numbers are lower, both the Black and Brown communities are still being affected quite a bit. And so we're just trying to do as much outreach as we can to try and build some of that trust to help people get the help that they need. Voy a pasar por la presentación más o menos rapidito para llegar a los puntos sobre las vacunas, pero sobre mi experiencia desde el verano hemos estado trabajando con pacientes de COVID. Los números han mejorado un poco aquí en Chicago, pero aunque los números han bajado, las comunidades afroamericanas y latinas todavía siguen siendo muy afectadas y queremos pues responder a las preguntas para que las comunidades tengan la información que ocupan. So I'll kind of go into the presentation right now. And then when I go through the side effects, I'll talk about the side effects that I had from the vaccine. Cuando paso por las áreas donde platico sobre las vacunas, voy a platicar sobre los efectos secundarios que yo tuve, porque ya recibí las dos dosis. Okay. So this presentation is in English. I haven't had a chance to translate it. But just to talk about education, help understand any hesitancy from the community, answer questions, and respect any decisions that individuals have. These decisions to have vaccines, to have something with any medication is a very personal decision, and then just provide some answers. Esta presentación es más para educar, entender, responder a preguntas y respetar las decisiones de las comunidades porque es algo muy personal. Why this presentation? Obviously, we're at, I think this morning I heard 417,000 deaths. But even though those deaths are there, these communities continue to be affected. Ha habido muchas muertes con el coronavirus, pero por todo nuestras comunidades han sido muy afectadas y por eso queremos pasar con esta presentación. Esto más es un resumen de por qué pedimos esas tres cosas: usar una mascarilla, lavarse las manos y mantener una distancia de 6 pies. Lo que se ve es alguien que está tosiendo. Las gotas respiratorias que tienen virus se van a caer dentro de los primeros 3 pies. Después de eso hay menos riesgo, pero por eso pedimos los 6 pies para que la gente tenga suficiente distancia para no contagiar el virus. Just a summary of the things that we're recommending: wear a mask, wash your hands, and then watch your distance. Most of the big droplets that contain or are going to contain virus are going to fall within that first 3 feet. But even then, you still have some droplets within the first 6 feet. So maintaining that 6 feet of distance is important. It's hard to estimate. But if you think about it, standing a distance of probably 5'2", so maybe add another foot, and that's how much, I think about if I were laying on the floor, how much distance. Yo nada más mido 5 pies 2 pulgadas y yo pienso que si estoy acostada en el piso, pues añado otro pie y ahí tengo los 6 pies. And then again, talking about covering your mouth. If I wear a mask, it protects someone else near me, but if we both wear masks, we protect each other. Si todos usamos mascarillas, si yo uso mi mascarilla, yo protejo a la otra persona, pero si 2 personas usan la mascarilla, los dos estamos más protegidos. Y es recomendable para la gente de 2 años para arriba, y la razón de por eso es porque alguien que tenga 2 años o más se va a poder quitar la mascarilla si es que no se siente cómodo. And making sure the recommendations from the CDC is still those 2 years and older. And the reason for that is the only reason we ask for that is you want to be able to make sure that if someone is feeling like they're having trouble breathing, they're old enough or they're conscious enough to remove the mask themselves. Los síntomas van a ser tos, dificultad con respirar, fiebre, escalofrío, dolor de cabeza, dolores musculares, dolor de la garganta, coágulos en la pierna o como si fuera un derrame cerebral. Pero hay alguna gente que no tiene nada de síntomas, entonces hay que tener mucho cuidado y por eso pedimos que todos usen mascarilla. So the nice list of symptoms, most common things: cough, shortness of breath, chills, fever, headache. But there are a lot of people who don't have symptoms, which is why we ask that everyone wear masks as much as possible. You don't know if you're carrying it and not feeling anything and spreading it to others. And then looking at who's at risk. People aged over 65, those with comorbidities, overweight or obese, diabetes, high blood pressure. ¿Quién está a riesgo? La gente más de 65 años que tienen problemas médicas, obesidad, diabetes, la presión alta o personas con enfermedades respiratorias. And keeping in mind how you manage your risk, right? You guys are in Arizona, warmer weather. You guys can spread outside. You guys can do things. So here in Chicago, we have to be careful about managing our risk, especially right now. We're getting snow. You know, I don't see my family right now, not in the winter. During the summer, I got to visit them quite a bit, but it's a little risky. I work with COVID patients, so to keep them safe, I see them on the porch when it's warm enough and I have enough layers. Esto es una imagen sobre cómo manejar los riesgos, ¿verdad? Si tiene una ventilación, distancia, ustedes están en Arizona, tienen la distancia, tienen el lujo de tener temporada mejor que aquí en Chicago. Ahorita estamos recibiendo mucha nieve. Y ahorita yo no veo a mi familia porque yo trabajo con pacientes de COVID. Entonces, se los quiero pasar a mis familiares y prefiero quedarme afuera y verlos cuando la temporada se mejora. So let's talk a little bit about vaccines. The tools, it adds to our toolbox, right? So you have our toolbox, which is masks, washing hands, and distance. And now we have vaccines. Tenemos nuestra caja de herramientas, quedarnos con una distancia, la mascarilla y lavarnos las manos, y la vacuna es parte de eso. Pero hay que platicar y el doctor Nuno va a platicar sobre un poco de esto, pero la comunidad médica sabe que no tenemos la confianza de la comunidad. Hay muchas cosas históricas y lo conocemos. So one of the things that before we start talking about vaccines is, you know, recognizing that there's mistrust, there's a lot of questions, there's a lot of historical things behind it. And we have to recognize that as the medical community. I am Latina, but I'm also part of the medical community, and we have to honor and acknowledge that that's going to be part of trying to get as many people as possible to get the vaccine. So in terms of vaccine hesitancy, we talk about medical history. You'll hear people talk about Tuskegee. You'll hear people talk about, even more recently, individuals who are under ICE, are under ICE in detention centers awaiting, you know, movement or processing. They're undergoing medical procedures that they're not aware of. We've lost that trust over a long period of time. The information hasn't been clear. Especially there's a lot of misinformation, disinformation out there. Home remedies that may or may not be harmful to other people, or even questions. Things haven't been cleared up. Where can you get it? How much does it cost? And you just have a lot of questions that haven't been answered. Platicando sobre por qué hemos perdido esa confianza. Hay muchas cosas históricas, pero también de personas que están bajo custodio de la inmigración, esperando proceso. El año pasado ha habido mujeres que han pasado procedimientos médicos donde no tenían el consentimiento, pero también la información durante esta pandemia no ha sido muy claro. Hay mucha información pasando por todos lados y es bien difícil decidir a qué le vas a dar confianza. Pero ahorita las preguntas que he recibido de mis familiares, de mis pacientes es, pues, ¿qué hay en esa vacuna? ¿Dónde lo puedo agarrar? ¿Cuánto cuesta? Si soy indocumentado, ¿lo puedo recibir? O me lo van a contar contra mí si todavía estoy indocumentado. Y todavía tengo muchas preguntas. So, platicando sobre las vacunas, hay 2 vacunas que son aprobadas por el FDA. el Pfizer y Moderna, las dos están más de 90% efectivo en prevenir infección con síntomas. Todavía hay posibilidad que alguien se infecta, que salga positivo, pero menos síntomas. Y hay otras dos vacunas que están en proceso, pero todavía no han sido aprobadas. Todavía están AstraZeneca, todavía está por un ensayo que se ha completado y tiene buenos datos. Johnson Johnson todavía están en proceso de completar su ensayo, pero todavía no tenemos esos datos. So the two vaccines we'll mostly be talking about are Pfizer and Moderna. They're over 90% effective. And those have emergency use authorization by the FDA, meaning that they're available to the public. There are two other vaccines in the pipeline or in the pathway. Their trials have either been completed or about to be completed. So far, there's positive data for AstraZeneca. We don't have data yet on Johnson & Johnson. So how do these vaccines work? Well, number one, Pfizer and Moderna are both mRNA vaccines. They basically, think about it, when you look at this picture, let's see if I can use this. I will use a spotlight. So you have this mRNA vaccine, or sorry, you have this virus. And as part of this virus, you have this little piece inside of its genetic code that tells it to make this spike protein. It's like a key to get into your body. So what they do is, rather than give you this whole virus, they package that little signal. It's like a Snapchat or an email. And they package it in a little piece of fat, a little lipid. And so that's what goes into the vaccine. So it's just a teeny tiny email that goes inside. It's an attachment. And then inside the lipid, so we'll consider the lipid an email, it goes in your body and basically tells your immune system, it gives it instructions to make that spike protein. So you only make this little spike protein here. You're not making the virus. You don't get infected with the virus, but your body thinks it's seeing a virus, so it makes antibodies against it. So you get an email goes away after a couple days, but the signal is there, that process is there. Okay, let's try this in Spanish. Entonces, aquí tenemos el virus completo, ¿verdad? Entonces, este virus completo tiene un pedacito de material genética y que es la señal para hacer la proteína que le decimos el spike protein. Lo metemos esa señal adentro de una gotita de grasa, que es lo que le ayuda a proteger esa señal, y lo metemos en la vacuna con agua, un poco de sal y la bolita de grasa, y ahí tiene la señal. Y su cuerpo lo ve, encuentra esa señal, la célula, se mete la señal a la célula y hace ese pedacito de la proteína del spike. Su cuerpo no es infectado con el virus, pero piensa que ve el virus y hace anticuerpos. Estas cosas verdecitas son anticuerpos. Y así responde su sistema inmunológico. Ok. Oh. Let's clear. Okay. Okay. So most common questions, and we'll get into these. Actually, we'll skip these and then I'll let you guys ask some questions. Oh, sorry. There we go. Okay, so side effects, right? That's the biggest question. So about 15% of people are going to feel side effects. Most of these side effects are going to be what we consider normal. It's your body's response to it's your immune system's response to thinking it sees a virus. We're basically tricking the virus. It's like a Trojan horse. So you may get some redness or swelling at the injection site. You may feel a little fatigue, a fever, muscle aches or headache. Rare side effects is a severe allergic reaction that we call anaphylaxis, where you can have trouble breathing, your throat closes up. but you'll be watched for about 15 minutes at all places. If you're going to have an allergic reaction, it'll happen within the first 15 minutes. The longest period of time that we've seen an allergic reaction happen is within the first 4 hours. But all injection sites, locations where they're providing the injection, they have EpiPens and they have protocols in case someone does. So, and then in terms of these side effects that people are going to feel, you're going to feel a little bit more after the second vaccine. These vaccines are 2 doses. The first one is kind of like, okay, just priming your body, letting your body see the vaccine. The second dose basically is like a booster shot. It tells your body, okay, you've seen this once, let's see it again. And you're going to respond, and your immune system makes more antibodies. For me, the first vaccine, I really only felt soreness in my arm. I got it on my left side. It felt like I had basically worked out only this muscle, the deltoid, and I was sore for about 12 hours. It wasn't bad. I barely noticed it. The second vaccine, it hurt more. It was a little sore for a little longer. I didn't have any fevers, any chills, but I was really tired. I had a lot of extra coffee the next day. No headaches, no muscle aches. I actually got the vaccine before I worked for 7 days straight, and I was still able to work all my 7 days in a row, no problem. And I'll let you know, I have a history of anaphylaxis or a severe allergic reaction to shrimp. I still remember what it tastes like, but I stayed a little longer just for my own benefit, just because if you do have a history of those allergic reactions, you are going to be more likely to have that reaction. That being said, out of 1,893,360 vaccines during the first dose, there were only 21 cases of people who had that reaction. So it's very rare, but it can happen. For me, I just wanted to be extra careful, and I stayed a little longer. Los efectos secundarios, 15% de la gente van a tener síntomas como dolor, hinchazón, un poco rojo en el lugar donde lo inyectan, cansancio, fiebre, dolores musculares, dolor de cabeza. Se escucha mucho como los síntomas del virus, ¿no? Pero es porque estamos tratando le estamos diciendo al cuerpo con esta vacuna que piensa que está infectado, ¿no? No está infectado, pero va a pensar que está infectado y va a querer hacer anticuerpos, y por eso tienes esas reacciones. Eso es lo más común, y la gente que cuando reciben la segunda dosis es cuando lo van a sentir más, porque su cuerpo ya ha visto esas partes, o va a pensar que está viendo el virus otra vez. Efectos secundarios menos común va a ser una alergia severa. Es una alergia que le decimos anafilaxis. Es cuando se le cierra la garganta, no va a poder respirar. Yo tengo historia de tener esa reacción, pero con camarones. Yo, por mi seguridad, me quedé un poco más de los 15 minutos que piden para estar segura de que yo no iba a tener esa reacción. Y estuve bien, no sentí nada. Para la primera vacuna me dolió mucho el brazo del lado izquierdo, se sentía como si hubiera hecho mucho ejercicio solamente en ese músculo del brazo. Para la segunda me dolió un poco más y me sentía con más cansancio, pero no tuve fiebres, dolores musculares, dolores de cabeza. Trabajé 7 días, recibí la segunda vacuna un viernes, y trabajé por 7 días seguidos. Sí me sentía cansada. En vez de llegar y hacer algunos quehaceres o cocinar, caminé la perra, me bañé y me fui a dormir. Eso fue todo ese sábado. Y preguntas. Esto es más sobre qué hacer si tienes síntomas. Yo creo que si, ya han recibido mucha información sobre esto, pero si tienen preguntas después, los pueden hacer. Y cuándo ir a la sala de emergencia, qué va a pasar si vas al hospital, y cuándo dejar del tiempo de aislamiento, y recursos que tenemos en Chicago. Pero se lo voy a pasar al Professor Nuno.
Gracias, Dr. Lopez. Thank you, Dr. Lopez. That was really informative, especially the vaccine part. And thank you for explaining how the vaccine works in both English and Spanish. Gracias por explicar cómo trabaja la vacuna en inglés y en español. So Professor Nuno, do you want to share your screen and talk a little bit about the research that you've done? And then we can go into questions after that.
Okay. Yep. And my Spanish is horrible, so if someone wants to translate for me, that would be great.
We've got Angelica here to help too with that.
Beautiful. So let me share my screen. Can you guys see that? Okay. Okay. Are we ready?
Yes.
Okay. Thanks. I'm a professor of political science at NAU, at Northern Arizona University. I'm the chair of the department there. I've also worked with a company called Latino Decisions. I just recently ended my term there, or my employment there. But we looked at attitudes towards the vaccines and attitudes towards the economy, political issues. And I'm going to share a little bit of what we learned throughout last year during a very heightened, attention to this issue. And as Dr. Lopez mentioned, there is a lot of suspicion and distrust in the Latino community because of past government actions that have really created this distrust. Dr. Lopez mentioned the Tuskegee experiment, where people, Black men, were exposed to syphilis without their expressed permission, and literally allowed to die with the disease. There's also several others that I'd like to mention, specifically within the Latino community, and there have been mass sterilizations of Latinos, of Mexican American women in the 60s and 70s in Los Angeles, where I'm from, and in Central America, similar to the Tuskegee experiment, where there was people exposed to STDs, syphilis, and experimented on as well. So the distrust in the community is well, well founded, and is no surprise that we see some skepticism out there when it comes to vaccines. We did surveys throughout the year of Latinos last year. And the first thing to understand is that Latinos have been overwhelmingly concerned about coronavirus. So when we asked Latinos throughout the year what was their number one issue that was important to them when coronavirus, the pandemic, was overwhelmingly the most important issue. Half of the respondents that we asked said that coronavirus was the number one issue. And we've never seen an issue dominate like this in the past. Maybe in certain states, I believe in Nevada in 2016, immigration became an issue that was roughly 45–50% of the people said that was the most important issue. But coronavirus and the pandemic was consistently over and over the most important issue, and it really wasn't even close. So because Latinos are largely in essential worker type jobs and forced to work, or else they can't pay their rent, or pay their bills. They've had to go into these workplaces and work environments where they're being exposed. In another survey, one in 3 Latinos knew of somebody that died of coronavirus, which is really a distressingly high number of people. And this was rather consistent throughout the year. So this is an issue that Latinos want addressed, and you can see by the graph here, we're looking at in different states, and we will see some differences in some of the questions that we asked by state, and it's an indicator of information networks and the quality of information that states are getting to the Latino population. We'll look at that in a second. Asking about specific concerns, most Latinos, the most important part was that someone else, that a family member would die or get sick. And a close second was schools. As you may know, Latinos are very young. The median age, meaning half are older and half are younger, of Latinos is roughly 28 years old in the United States, which is really young. Among the white population, the median age is roughly 46 years old. So Latinos are very young compared to other groups in the United States. And young people have kids, and so getting back to school, and this is why education continues to be a very important issue for Latinos. And so people in the workforce, Latinos also have the highest workforce participation rate in the country. So Latinos are working, they're having kids, sending kids to school. These are the 2 largest and most important issues and concerns amongst Latinos throughout the pandemic. Angelica, do you want to jump in, or do you want me to just go through it?
Whatever feels good to you. I can definitely, if you go back one slide, just kind of talk over what you said.
Okay. Do you want me to go back to this one?
Yeah, we could start there.
Okay.
Entonces habla el profesor Nuno, que es un maestro de ciencia política en NAU. Él ha trabajado con varios grupos latinos, entonces él está platicando sobre proyectos de COVID. El año pasado él se enfocó en estos temas y en qué temas les interesan más al público latino. Como dijo la doctora Lopez, ha habido ciertos proyectos médicos que han lastimado a la comunidad latina, entonces hubo esterilización de mujeres sin consentimiento. El año pasado, el profesor Núñez le preguntó a la comunidad latina qué eran los temas que eran más importantes que enfrentaban. Could we go to the next one, please? Entonces, aquí vemos que el número 1 fue la pandemia y el coronavirus, porque muchos de los latinos son empleados de trabajos de servicio, entonces puede ser que necesitan trabajar en persona y no pueden quedarse en casa. El profesor Nuño también nos dijo que 1 en 3 latinos ha conocido a alguien que ha fallecido del coronavirus. Can we go to the next one, please? Cuando él les preguntaba qué eran las cosas que más les impactaban, decían ellos que tenían miedo que algún ser querido falleciera. La edad mediana de los respondientes era 43 años de edad, entonces los latinos son más jóvenes y por eso la segunda cosa que más les importa es sobre los hijos y las escuelas. Tenían miedo que las escuelas abrieran demasiado temprano y muchos más niños se enfermaran. All right, we are caught up.
Awesome. Thank you. This graph here shows some differences along the states, which is a good indicator of how the states are communicating the impact of COVID to the Latino population in those states. So when we ask them if the worst of the pandemic is behind us, in total, 61% thought that it is not behind us. The worst is still yet to come. But you can see places like in Florida and in Texas, how different Florida and Texas are, or compared to, or Florida in particular, different from the other states. And if you've been listening to the news, we can see the leadership in Florida is taking a decidedly different approach to COVID-19 as some of the other states. Arizona, we can see a little bit lower than some of the other states like California and Colorado. which probably have better communication networks for Latinos, and so we can see the impact that that communication has on Latinos. Angelica?
Esta figura nos enseña las diferencias entre los estados. Entonces le preguntaron a la gente si lo peor de la pandemia ya había pasado o no. Entonces en el rojo más fuerte vemos que mucha gente piensa que todavía viene lo peor de la pandemia. Como dice el profesor, que aquí en Florida vemos que ha cambiado un poco el liderazgo y tal vez se siente la gente que lo peor de la pandemia ya ha pasado porque ha habido más recursos en español.
And so, so it's really important so that policymakers and our leaders know that how they're communicating to Latinos actually has an impact on how they on their information about the pandemic. In this one, we ask their concerns about laws and how important it is that these that any law that Congress passes contain this. Probably the most important issue that Latinos were concerned about in any COVID-19 law was having free testing and treatment of COVID-19. One other important statistic with Latinos is median wealth of Latinos, meaning half is greater and the other half is below. The median wealth of Latinos is about $14,000. And so when you add up all of Latinos, what they own, and then all of what they owe, their debt, it's about $14,000. For whites, it's about $150,000. So whites have about 10 times more wealth than Latinos do. And so Latinos are very concerned about the costs of treatment and the cost of vaccines. So communicating that the vaccine is free, communicating that it's not going to cost you anything, that you don't need insurance, all of these kinds of communication points are very important for the Latino community. I just got my my vaccine last week, and it went well. I'm totally fine. I just had a little soreness in my arm, but making sure that it's free, and then also again attention to schools were the two most important issues for policies. Angelica.
Entonces aquí el profesor habla de cómo se les preguntó a la gente qué es lo más importante para ti que sea nueva ley. Entonces la número 1 fue que la vacuna sea gratis o de menos costo. Entonces la razón por la que el profesor cree esto es porque el promedio de ingreso de los latinos es $14,000 al año. Entonces es importante comunicar que la vacuna es gratis y no se necesita aseguranza. El profesor también se tomó la vacuna y también dice que solamente le dolía un poco el brazo.
So I guess one of the reasons why it's great to have Dr. Lopez on here is because Latinos also overwhelmingly trust doctors with information about diseases, about treatment, and when we ask them who they trusted the most, doctors continuously throughout the year were the most trusted members of the community when it came to treatment information. And then there was a large drop off for the federal government, local health experts, and of course, Donald Trump. 65% of Latinos did not trust Donald Trump. But doctors, so listening to doctors. So in policy wise, it's important that when we try to communicate to people, not only getting the information to them is important, but the way in which we get the information to them is also important and can have an impact on their trust of vaccines. Angelica.
Aquí el profesor reporta que se les preguntó a la gente en qué expertos confía usted. En rojo vemos en quiénes tienen la confianza y en gris en quiénes no. Entonces vemos que el número 1 es su doctor, su proveedor y en último lugar el presidente Trump.
Here asking, so you know, a lot of folks say that there's a lot of distrust out there. But despite that, there is 72% of Latinos said that they're likely to be vaccinated once vaccines are come out. So that still means that 30%, 28, 30% still say they are not likely to get the vaccine. But you can also see state by state how communication networks can impact one's likeliness to get vaccines. So in a place like Colorado, for instance, 63% versus a place like California and in Florida. And so we can see that these networks can also have an impact on the likelihood of getting vaccinated. There could be some different effects for education with that is going on here as well. We can also see some differences between men and women. And so it's important when we look at statistics like this that we not only frame our message, maybe perhaps having doctors putting out the messages, but also targeting different folks like women, targeting women to make sure that we can address the differences in likelihood to get the vaccine. Angélica.
Aquí se les preguntó a la gente si se vacunarían si se les hace disponible la vacuna. Vemos otra vez una diferencia entre el estado. En Colorado, 63% de latinos, al comparar con 65% en Florida y 73% en California. El profesor dice que otra vez vemos la importancia de obtener información en español. También vemos una diferencia entre los hombres y las mujeres. Entonces, viendo estos datos, tenemos que pensar en cómo comunicarnos con la comunidad, por ejemplo, por tener doctores que nos digan sobre la vacuna y los efectos secundarios.
And finally here, looking at when Dr. Lopez talks about concerns about the vaccines, probably the biggest concern in our survey, almost 80% said they're worried about long-term effects. So a lot of folks may expect some short-term effects, some soreness, maybe being sick or drowsy, but there's concerns about long-term effects. And so having some education programs and education on the long-term effect of the vaccines might be important to get folks and alleviate the concerns so that they can get the vaccine. So and we have the bad side effects, and also people are concerned that they may not be able to get to work if they get the vaccine. So messaging, hey, get the vaccine, you can go back to work, and you're just going to get a little soreness. And long term, this has no effect, or here are the effects, rather minimal. Addressing those sorts of concerns as well can improve vaccination rates in the Latino community. Angélica.
Finalmente, aquí vemos las preocupaciones sobre la vacuna. Entonces, el profesor dice que necesitamos educación para darle más información a la gente para aliviar estas preocupaciones. Por ejemplo, vemos número 1, efectos a largo plazo, efecto secundario malo, o tal vez que la vacuna no sirva. Entonces, otra vez, el profesor expresa que es importante tener esta información para estar educados sobre qué va a ser la vacuna en sí.
And that's it. Thank you very much for letting me come on here and give this information.
Oh, thank you, Professor Nuno. That was very, very informative. And, you ended on a good slide in terms of talking about the reservations on taking the vaccine. And so I'm going to kind of just jump into questions. And if those who are watching, if you've got questions, put them in the chat. So, we talked a lot about, is it safe? What the difference is between vaccines, but something I feel has not been asked a lot is, should pregnant women or breastfeeding women take the vaccine? Una pregunta que yo tengo, hemos escuchado qué es la vacuna, diferentes efectos, pero no hemos escuchado mucho sobre si mujeres embarazadas o deben de tomar la vacuna. Doctora Lopez, tal vez puedes explicar un poquito más sobre eso. Dr. Lopez, maybe you can talk about that a little bit more.
Yeah, sure. So the vaccines that were studied, both Pfizer and Moderna, the youngest age so they were studied in ages 16 and older. And they did not include pregnant women. Cuando hacemos estos ensayos, los ensayos para Moderna y Pfizer, incluyeron a personas de 16 años para arriba. And so, no incluyeron a mujeres que estaban embarazadas. Aún eso, había mujeres que eran parte del ensayo, pero por algún punto del ensayo salieron embarazadas. So there were women that were part of the study, had signed up or didn't realize that they were pregnant and became pregnant during the course of the study. And so the things that we look at for these studies, the big questions are, is it safe and does it work? That's a phase 3 trial. And so number one, at least up until now, those women who did become pregnant during those studies, there haven't been any harmful side effects to either the woman or the fetus, the child. And they're going to continue to follow those. Given that information, I call it ACOG, it's for short, but I believe it's the society, the overall arching society for the obstetrics and gynecology did come out with a statement that said that it is a very individual, personal decision, but that they do recommend that women who are pregnant or breastfeeding get the vaccine if they feel that it is safe, if they feel comfortable doing so. And the idea behind that is that one, pregnant women are at risk for having some serious side effects from getting the virus itself. But also if a woman is breastfeeding, we do give pregnant women certain vaccinations so that they can pass on those antibodies in their breast milk to the child. So right now, the Society for Obstetrics and Gynecology is recommending that that women do so if they feel comfortable doing so. Durante el ensayo, había mujeres que se habían puesto en el estudio. Los estudios fueron para asegurarse que todo estuviera seguro y efectivo. Funciona y si está efectivo. Había mujeres que salieron embarazadas, no sabían que estaban embarazadas o salieron embarazadas durante el tiempo que estuvieron en el ensayo. Y la organización de ginecólogos pusieron una opinión y dijeron que ellos piensan que si la mujer piensa que es lo más seguro para ella, que estuviera bien que tomara la vacuna. La razón por decir eso es que mujeres que están embarazadas pueden estar a riesgo de tener efectos más severos por infectarse con el virus. Y por la enfermedad que sale del virus, pero también hay vacunas que mujeres embarazadas reciben para poder pasar los anticuerpos de la leche al niño. Entonces están diciendo pues para proteger a la mamá y para proteger al niño, sí se puede tomar la vacuna si la mujer se siente segura tomando la vacuna.
Muchísimas gracias, Doctora Lopez. Thank you, Dr. Lopez. That was really, really informative and, great points too. When I was pregnant, they had me take, different vaccines. And like you said, it passes along to the baby. And so that's a really great point. Thank you for that. Angelica, do you have a question?
Yeah, so I wanted to know if I'm undocumented, how can I get the vaccine? Le preguntó a la profesora y al profesor y a la doctora si soy indocumentada, ¿cómo puedo conseguir la vacuna?
So right now, it depends state by state. The U.S. government is purchasing all the vaccines, and that it is up to each state to distribute those vaccines. I'm not sure if you guys have more specific information on Arizona, but at least specifically in the city of Chicago, our mayor has stated that anyone who is undocumented, if they want to receive the vaccine, they will receive the vaccine. On a nationwide, I'll probably answer another question in this as well, because the U.S. government is purchasing these vaccines. There is no cost for the vaccine. Some clinics may choose to charge a small cost, but just for the actual visit to administer the vaccine. el gobierno está comprando estas vacunas y se lo está distribuyendo a los estados. Depende de cada estado cómo van a distribuir esas vacunas. A lo mejor tienen más información sobre Arizona, pero aquí en Chicago, en Illinois, hemos decidido que han dicho que la gente que son indocumentadas, si quieren una vacuna, lo pueden recibir. Como ya está comprado por el gobierno, la vacuna, la material es gratis, pero algunas clínicas a lo mejor van a cobrar un gasto bajo por la cita, por hacer la inyección.
Gracias, Dr. Lopez. And I don't know, Professor Nuno, if you happen to know in Arizona. I unfortunately don't know.
I don't know. I know I found it interesting that the last priority in Arizona, and this might be in other states as well, is Spanish-speaking folks. And so that I think that's really interesting in how they're going to identify those people. I'm also concerned that a lot of Latinos, especially when we were doing surveys on the census, a lot of Latinos who have undocumented members in their household are concerned that if they interact with the government in one way or another, they're going to be exposing their family member who is undocumented. So one of the concerns that Latinos usually have, and most undocumented immigrants live with in a mixed status household where someone's undocumented, permanent residency, on a visa, and citizens. Many family members are very concerned that this information might be used against the family if there is an undocumented member in the household. So it's really important that that is communicated, that there is none of this data is collected, and citizenship is not asked, and that if you are undocumented, you're not going to be in one way or another, or if you have an undocumented member in your family, your household's not going to be targeted. So members might say, I'm not going to get vaccinated because I don't want to expose that family member to deportation in one way or another.
Angelica, do you want to translate what Professor Nuno said?
No, sorry.
Sure. Dice el profesor Nuno que en su estudio vimos que muchos de los respondientes del proyecto tenían miedo de que sus parientes sin documentación tengan una relación con el gobierno o que tengan que ir y poner cualquier cosa de ellos. Dice que muchas de las familias son de estatus mixto, entonces muchas veces les da temor, pero él quiere aclarar que no se pregunta por ciudadanía cuando uno va por la vacuna.
Gracias, Angelica. So, Dr. Lopez, there's been all these new strains coming out, and especially here, just a couple states from us, is the California one. How is that? Do you know anything of how that's going to impact the vaccine and how effective that vaccine would be against those new strains? Hay nuevos, ¿cómo se dice en español?
¿Variantes?
Variantes, gracias. Del COVID que han empezado a salir, como por ejemplo que acaba de salir de California. Y la pregunta es sobre si la vacuna, ¿qué efecto va a tener con esos diferentes variantes?
Yeah, no, it's a good question. And I think something that as doctors, as anyone who's in healthcare right now, anyone who's in our communities that's being affected, we worry about it, right? One of the things that I was most worried about is if we get something that's more contagious and you mix it in with the American way, it was just going to spread like wildfire. But at least right now they have and continue to do studies to make sure that at least currently right now, the information that we have is that Moderna and Pfizer vaccines are still effective against the B1117 strain, the strain from the UK they are working to do studies on the South African strain. The way I think about it is if you, the vaccines help you make the spike protein, think of it like a key. It has all those ridges on it. And if you only change just one tiny ridge, you still have a ton of other ridges on that key that your antibodies are going to find and react against. So right now, at least that's our thought process and what the evidence we have, that the vaccines currently right now are still going to work against the strain that's here, the new strain that's here in the US. So fingers crossed we can get enough people vaccinated to protect them, because the more any virus has a chance to spread, the more chance it has to mutate. So the faster we can stop people from spreading it from each other, we can keep the strains we have and make sure we protect ourselves against it. La información que tenemos ahorita es que las vacunas que ahorita están, Moderna y Pfizer, todavía funcionan contra el variante que es de Inglaterra. No sabemos todavía no tenemos información si todavía funciona contra el variante en South Africa, en el África del Sur, pero están haciendo estudios. Lo que yo me imagino es una llave, hay muchos puntos en esa llave, si cambia un poquito parte de esa llave, los anticuerpos todavía toda la llave, no nada más una parte. Entonces, hasta ahorita todavía funcionan, pero lo más importante va a ser es que si ese virus tiene oportunidad de meterse a estar expuesto a más personas, tiene más oportunidad para cambiarse. Entonces, hay que usar las mascarillas para prevenir que se vaya a contagiar a otras personas, para prevenir que no se vayan a hacer más variantes y para seguir usando las vacunas para protegernos.
Gracias, Doctora Lopez. Angelica, I think you have one more question.
Sí, entonces le queremos preguntar a la doctora, si yo tengo COVID o síntomas de COVID, ¿me debería vacunar? If I have COVID or symptoms of COVID, should I get a shot?
So right now, at least, when we say that things are safe and effective, what we're saying, at least what the information that we have right now, you should get and most everyone is eligible for a vaccine. For anyone that has had COVID, we want them to wait 3 months until after they've recovered from COVID or from when they've had a positive vaccine. And that's only because you likely already, you will have antibodies already, but those antibodies don't last forever. So you're not protected forever. The vaccine is going to give you higher amounts of antibodies. So yes, you can still get the vaccine if you've had the virus. We just ask that people wait about 90 days or 3 months until you get the vaccine. And right now we anticipate that you should have a lot more antibodies and protection from the vaccine than if you got infected at some point during the year. Si te has infectado o has sido infectado por coronavirus, sí sugeríamos que la gente reciba la vacuna, nada más que reciben la vacuna 90 días después de que recibieron ese resultado positivo, para asegurarnos, porque sabemos que alguien va a tener anticuerpos después de tener la infección, pero no sabemos por cuánto tiempo van a tener suficientes anticuerpos para estar protegidos. Entonces queremos que esperan 90 días después para recuperarse y luego recibir la vacuna para estar más protegidos después.
Gracias, Doctora Lopez. And final question to that, do you know if we have to get the vaccine annually? Is it a one-time thing? ¿Tenemos que conseguir la vacuna cada año o solamente es un vacuna por vida?
So that we don't know yet. It's a very good question. So there's a lot about the virus that we're still learning. Like a couple months ago, we didn't know that there were variants like the one in the UK or in South Africa. But we are still gathering information from those studies that were done to see how long those people are protected. So we don't yet know. Our best guess right now is that it might end up being a lot like the flu vaccine. You know, you get a booster every year, maybe every 2 years. We're not quite sure yet. So there's still studies going on to collect that information. So we'll find out more information hopefully in the next coming months. La pregunta sobre por cuánto tiempo dura la protección con la vacuna, no sabemos. Todavía estamos colectando los datos de esos ensayos que hicieron Pfizer y Moderna para saber por cuánto tiempo la gente está protegida y cada cuándo se tiene que tomar la vacuna. Todavía no sabemos, pero estamos todavía estudiando todo.
Muchísimas gracias, doctora Lopez, and thank you, y también el profesor Nuno y Angelica. Thank you, Dr. Lopez, Professor Nuno, and Angelica for your time. You know, before we end, I do want to just do a huge shout out to Dr. Lopez. She has, as she mentioned, she's been working with COVID patients since March. And you just make us so proud as a Latina doctor in a very, very large community. And the fact that you spent, you were on call today, and then you took the time to do this, it's just so admirable in the work that you do. We are eternally grateful for everything that you're doing, not just for your community, but honestly for the entire country. Dr. Lopez has been featured in HuffPost and also on MSNBC, and she has just, I'm blown away. I've known Dr. Lopez for a number of years now. We went to college together, and it's just been hero status here. So I'm a little bit fangirling on you right now, but thank you. And I want to just also make sure we ask you how you're doing. Para ellos que están escuchando en español, la doctora López estoy dando las gracias por ella. Es una doctora que ha estado trabajando con pacientes que han tenido COVID desde marzo. Y por ejemplo, hoy ella estaba on call todo el día y después vino a hablar con nosotros sobre la vacuna y el COVID. Y todo lo que ella está haciendo para nuestro país, para su comunidad, muchísimas gracias. ¿Y cómo te sientes, doctora Lopez?
Well, thank you. You know, it's been a long road to get to where I am, but I feel like I'm where I need to be. I feel like I'm where I'm meant to be. And, you know, thank you to you all for providing this platform, for helping get people some information if it helps them make a decision. You know, that's the goal. And I just can't wait. Like, when I'm allowed to travel, I plan to go to my grandfather's farm in Mexico, milk some cows, have a cafecito de la olla. So I'm looking forward to the day that I can just kind of, you know, chill out a little bit. Gracias a ustedes por tenerme aquí. Me da, you know, estoy muy emocionada por estar aquí para compartir información. Es un gusto y siento la responsabilidad a la comunidad, a mi comunidad, a darles la información que ocupan para hacer las decisiones para ustedes mismos. Pero sí estoy cansada, pero espero el día que me puedo ir al rancho en México a tomar un cafecito con mi abuelo.
Muchísimas gracias. Y muchísimas gracias también al profesor Nuno. Thank you so much, Dr. Lopez, and thank you as well, Professor Nuno, and also Angelica. Muchísimas gracias a todos.
Thank you.
Thank you.
Thank you.
Adiós.
Sarah, that was great. Really great.
Thank you. Well, and thank you, Angelica, for helping too. I think that was awesome.
Oh, no.